Now I'm here at Wesley Hospital at Ashfield, and I'm here particularly to see the hospital out on site like we're doing all through this series, and also to talk to Catherine Andrews. Good to see you, Catherine.
Pleasure.
Catherine, how long have you been working here?
I've been working for Wesley Mission for around 2.5 years, initially as a clinical nurse specialist and now as the Director of Nursing of Wesley Hospital Ashfield.
So what does Director of Nursing mean in simple terms?
Well, in simple terms it means that I'm the manager of the clinical care for this facility. So I look after the running of the care for patients, so I manage to ensure that there's enough staffing, that patients are well cared for, and that they're provided appropriate care. What does happen as the Director of Nursing of a small facility, because we are only 38 beds here, is that you do get called into a lot of clinical de-escalation. In other words, when people are troubled with things. So I do get called into that.
And because of the kind of hospital it is, that really is part of the story.
It is.
We deal with people with all kinds of challenges. I mean, what sort of things, without, obviously there's a privacy about all this, but what sort of things that people have to
When
face?
people are struggling, and especially with conditions such as eating disorders, so you have anorexia or bulimia, when patients come with some psychiatric concerns where they have depression or anxiety, or they just feel that there's extreme levels of not coping in their community. And the other issue is that we have a drug and alcohol service. We actually, we're very small in this drug and alcohol service, but we're very skilled, and we have some very good practitioners, and we also have some very good therapy services. So we're just not a medical unit, we have therapy, and obviously including a very good and effective nursing care staff.
How many clients have we actually got in this hospital?
We have 38 patients in this hospital. They are from the areas of eating disorders, so we have anorexia and bulimia, alcohol and drug issues, and we detox all areas of drug issue when patients have drug issues, not just alcohol. Alcohol is the major drug issue of use, but all drugs are detoxed here, and general psychiatry, so depression, anxiety.
Catherine, what is it that you get out of the job that you do?
Well, I've been a nurse for over 30 years, and you would have to say the fact that you do make a difference, and the fact that you do have an opportunity to assist someone when they're at their most complex or difficult, or when they're just really struggling and they're having sort of a need for someone to help them.
So there's a vulnerability at that point.
Absolutely.
And you come alongside and you can, I don't expect you to do this, but you can in your own mind recount stories of people who've come
Absolutely.
at that point and of their lives have been turned around by coming.
Absolutely.
Is the fact we're a small hospital a very positive thing sometimes?
I believe it is, because you can actually have develop very close relationships with our patients, and so you can actually make a difference to them, because we really are a community, and what happens out in the real community is people get disconnected. We encourage them to understand we are connecting them, and we model behaviour. So in other words, when patients are eating here, we actually eat with them. So we actually show them that people can eat when patients are here.
Look, I think one of the things that I'm conscious of, and certainly conscious of that, is the effect upon families of so many of these things. And I'm thinking, in my experience, drug and alcohol abuse doesn't just affect the person, it affects everybody. And I'm sure that's true with eating disorders of all kinds.
Absolutely, because it's by the time someone's coming to us, there's already 10 years worth of ill health, or they've been struggling, and really it does come back down to the fact that when you can't eat food with your loved ones, it's a real problem with your connection with your family, because we are a group of people who like to share.
So do you find that you're actually helping the whole family in a way?
We are.
People, they're not patients themselves, but they're very much part of the story.
They are a part of the story, and we are a part of their recovery. So it's really focused on hope and recovery.
And hope is a very profoundly Christian concept that we embrace throughout Wesley Mission, and I'm just pleased to see it happen here. Cathy, we're so thrilled to talk to you. It's good to be here at the hospital and to share something of that experience with you.